Hi, everyone. My name is Brinley, and I am the founder and executive director of HS Connect, or hsconnect.org, for those of you who don't know us. And today we are here with Kira Barr, and we are going to talk to Dr. Barr about somatic skincare, which is something that she developed and created, and talking a lot about how HS and living with HS impacts more than just the physical body, how it goes beyond our skin and really has a lot of emotional impacts on those of us who suffer. And we kind of want to dig a little bit deeper into that and get your insight on how that, from your point of view, like how the skin impacts emotional and vice versa, because you have some really interesting thoughts on that. So first of all, I'm not going to give this big introduction about you. Why don't you tell us what you think is important for us to know, instead of saying all of these fluffy things, because I think that's what's more meaningful for people.
No, I appreciate that. Listen, I come to this work from a very personal place. No, I do. I don't know what it's like to walk in the shoes of someone living with HS, but my own health fell apart. My own skin was changing, diagnosed with melanoma, gut issues, hormonal issues. So I understand that sense of frustration of going to doctor, trying all the pills, the podcasts, and nothing is working, and feeling isolated and frustrated and alone. Um, and so it really led me to a path of my own self-discovery, integrative medicine, functional medicine, and really led me to mind-body medicine, which is more than just the mind body, it's mind skin. What most of us, even in dermatology, having been in dermatology for, over 20 years, we learn about the mind skin connection, but most of us don't appreciate that your brain and your skin are derived from the same layer of embryologic tissue, so they're talking to each other at all times. And doing this work, we get to kind of listen in to, like, what is the quality of that communication and that relationship. And the beautiful thing is that we can change the dialogue. We can change that relationship to support our overall health and well-being. Because at the underpinning of all of this, why I'm saying all this stuff, is the common denominator for all chronic disease is stressors in all its different forms: physical stressors, emotional stressors, environmental stressors, and that activates our stress response system, that increases inflammation, throws our hormones off, and it shows up in our skin in so many ways. So this is why a lot of our conversation will be about how do we regulate the root cause of that? How do we learn how to regulate our nervous system that is the driver for all our other systems going out of balance?
Yes, and so in full disclosure, I've worked with Dr. Barr in the past, and so we've had many conversations, and there's been quite a few things that you've said throughout our conversations that have really resonated. And some of them were so, I don't want to say not profound, because I don't mean it in that sense, but like you made some comments about, like, one of the things that stuck with me was the hugging yourself piece, right? That it's little tiny things that you've mentioned that are things we can do to help regulate ourselves, that are not ginormous changes, right? So many of us think that if you're looking to make a change about stressors or outside influences on our lives, and that we feel like we need to make entire life changes, as opposed to it being the small, simple things that can make a bigger change than we anticipated. So can you tell us about that? Just as a way to kind of jump into one of the mechanisms that we can use as HS patients to potentially help soothe and normalize.
Yeah, I think that's number one. Let's just normalize this. Life in general is challenging, and there will always be stress. And stress is not a bad thing, right? There is what we call good stress, eustress, like you're getting married, you're going on vacation. There's some planning involved, but it's something that we look forward to. What we're talking about here is distress, things that we don't want to happen, that are happening, that overwhelm our capacity to handle it. And that's really where trauma comes in. When we talk about stress and trauma. Trauma can be a big catastrophic event. It could be micro, small events. Really what trauma is anything that overwhelms our capacity to handle it. And when it comes to living with HS, there's a lot of things that can overwhelm your capacity to deal with it. You've got procedures, you've got going to the doctor, you've got the pain, you've got the symptoms. And when we feel overwhelmed, the natural association or disassociation, like why would we want to be in connection and in relationship with a body that feels like it may be betraying us? So we disconnect from it. And what Brinley and I are talking about is finding small ways to reconnect, because your system, your nervous system, is actually working in service of your survival and on your behalf. It's always looking out for danger and threat. And sometimes that perceived threat is a scent, a smell, like going to the doctor, what have you. So we can tell ourselves that it's okay, that we're safe, but your body doesn't know that. So we have to speak the language of our body. And that's where something like a hug comes in, right? Soothing self-touch is so potent and powerful. And it's not just woo-woo stuff. I know some of you might be listening and be like, whatever. But there's actually a really scientific reason why hugging should be part of every person's skincare regimen. And you don't need somebody else to hug you, especially if you're in pain, it's uncomfortable, you don't want someone touching you. You don't need that. A self-hug, a soothing self-touch, wherever feels good to you. You could touch your arm, your head, your legs, just a soothing self-touch. And it's because there are nerve endings in our skin that are directly in communication with the part of our brain that regulates our emotion. It regulates our emotion and also releases hormones like oxytocin, which is our love hormone, our feel-good hormone, which is the direct antidote to your primary stress hormone, cortisol.
Yes, it's been such an amazing thing to learn and to figure out, even just, through my time in talking with you, about how much trauma, I think, especially HS patients, and I think others, patients with other skin conditions as well. But for our community specifically, when you were talking about trauma, I think a lot of us don't fully understand or appreciate the trauma that we've experienced. And when you were talking about, major trauma, we're all aware of what that looks like in life. But the minor traumas are things that are cumulative for us, like going to the derm and not being helped to the degree that we think that we should be helped, being told that we need to quit smoking or lose weight, that our HS is basically something that we're creating or continuing to have happen. Really feeling isolated and alone by our disease. Is all of these things are, I don't want to call them minor traumas because I don't want to downplay them, but they don't show up on the same level that all of these major traumas that people are like, oh, you lost someone you love. They can understand what that feels like. But for us, really the only people that you feel like can understand are other HS patients who've been in those same situations. But I don't think we spend enough time really giving that trauma the credibility that it deserves. We just kind of push it down. So what do you recommend for those of us who are kind of just figuring out that all of these things have been traumatic? And I know for myself, I don't want to give it too much credit because I also don't want to live in that space of making sure that that trauma is like serviced, but I also want to just acknowledge it and then figure out how to like come to terms with that. So what would you recommend for that?
Yeah, so much of what you said is so important. As I mentioned earlier, we're wired for survival. So our nervous system is always going to act in service of our survival. So when we encounter some of these experiences, it's a physiologic response. Just to normalize that there's nothing wrong with you if you go into like panic mode or shutdown mode. your body is doing what it thinks it needs to do. So that's number one. And once we realize that, we realize it's not a flaw inside of ourselves. It's actually a physiologic response that once we're aware of it, we can learn tools and skills to help redirect it. Like the alarm is going off, but we can to be able to be discerning once we know how we experience that in our body. Is this a real alarm, or is this a false alarm that I can attend to and let my body know that it's okay? To your point of trauma, right? I think we think that somehow we're flawed or broken, or there's something wrong with us. Again, trauma is, as Dr. Gabor Mate, it's not what happens to you, it's what happens inside of you as a result of what happens to you. So if you've gone to the doctor, right, we're wired for survival, and we also have basic human needs. And those are to be seen, heard, understood. We want to know that someone gets us. And if we started off our early life with a caregiver who wasn't attuned to us, who didn't really see us or value us for who we really were, our nervous system is already on high alert. We're already kind of vulnerable in some ways to feel, the pain on a higher level. We may not have as much resilience. Then we go to the doctor and it's a similar experience. It's a similar experience. And we don't feel seen, we don't feel heard, we don't feel validated, and it can feel very isolating and alone. And our nervous system doesn't know how, it doesn't have that capacity to be like, all right, this is not the same as back there, back then. Like I understand what's happening. I can use my voice. I can speak up and say, you're not understanding, or this is very frustrating for me, or what, being able to vocalize and normalize what you're experiencing. To your point, I know I'm like going kind of all over the place, but I think it's so important that, like you said, you don't want to live in the trauma story, that this is trauma that happened to you and you're stuck there. It's, I had this experience, this is my lived experience. I'm going to acknowledge it and normalize it. And then I can be empowered to change the narrative around my experience of that. We cannot change the past, but we can move forward from there. And part of that is knowing, how do these experiences, when you go to the doctor, how is it making you feel? Where do you notice? Like people say, like, I'm so stressed, I'm so anxious. How do you know that? What inside of you lets you know that you're feeling sad, that you're feeling anxious, that you're feeling frustrated? At the same time, how do you know when you're feeling joy, when you're feeling happiness, right? It's not all the bad. It's learning where and how does that show up in your body? Because once we know that, we can work with it. We can cultivate that felt sense of safeness, of some of these better, like more supportive, nourishing emotions and actions, and the things that we can do to help generate that for us, especially in moments like going to the doctor when it's there's a lot of uncertainty, a lot of trepidation.
So what do you think the first step is for people who tend to feel like anxious and nervous and uncertain, even, especially when you're at the beginning of your journey, or you've just sought, care with a dermatologist, and there's a lot of anxiety almost about going to a first appointment, or what is it going to look like and what you can expect. So what do you recommend for people who do start off with that anxiety? And then we can go into afterwards, like people who've had that trauma, how do you kind of start to work through that?
I think the biggest thing is tapping into what are the things, like we talk about resources, right? And there are two types of resources. There's external resources and our internal resources. External resources may be people who can offer you support, is bringing someone with you to the doctor, so that if your brain shuts down and you're feeling overwhelmed, you have a companion by your side who can be the ears for you, who might be able to be a voice if you feel like you can't speak, right? What are the people, places, and things that can offer support and comfort? For many of us, like, this organization is amazing. Having community. Do you have hobbies? Do you have something, like, especially going to the doctor, is there a stone or a gem or a fidget thing that you can hold on to remind you that you are here in this present moment, right? There's internal resources like creativity and sense of humor and our resilience that we can cultivate. And this is also where our somatic resources come into play. If you're in the doctor's office, a few simple practices that you can do, right? Part of where the anxiety and the overwhelm comes from is that we are spinning out in our past experiences, worrying it's going to be the same as it was before, or we're in panic mode because we have no idea how it's going to go, and it's the uncertainty, both of which pull us out of our present moment experience, right? But life is lived here in the present. So how can we bring ourselves back into the present moment? One of the ways is when you're sitting in the exam room, is creating a connection to the earth beneath you, right? Finding your feet on the ground, being grounded in the present moment, feeling a connection with your shoes to the ground, your bottom on the seat, maybe your back against the chair if there is one, for a little bit of support. Yeah. Another thing too that can be really helpful if you're feeling panicky is what we call orienting. Using your sense of sight and body, sometimes just changing our position can change our whole perspective, but looking around the room, allowing your eyes to settle on an object and just take in the color, take in the texture, take in the shape, and do that, scanning the room for as long as you need to until you can feel, okay, I'm feeling a little bit better. And normalize and name it. If you're in the exam room, you could even say to the physician, I need a minute. I need a minute. But grounding can be very helpful. Orienting can be very helpful. And tapping into and tuning to how you are breathing can also be very helpful. Oftentimes when we are in kind of panic mode, we don't realize we're holding our breath. So even the simple act of bringing awareness to, am I breathing? How am I breathing? Am I breathing out of my nose? Am I breathing out of my mouth? Am I breathing slow? Am I breathing fast? Am I breathing out of my chest? Or can I allow myself to breathe deeply through my belly and feel the expansion of my belly, the expansion and contraction? And a helpful thing too is with your inhale, take an extra long exhale. That sigh, kind of like, because it's on that exhale that you're activating that rest and relaxation response, the part of your autonomic nervous system, the parasympathetic branch that activates what we call the vagus nerve that wanders all throughout the body, your lungs, your belly. It helps kind of regulate how all things work. It activates that with an extra long exhale. So those are 3 simple practices that you can do while you're sitting still that take very little time, but it'll help bring you out of that kind of panicky situation, out of the past, out of the worrying about the future, into the present moment. And it takes practice. It takes practice. It might not feel like it's working, but don't give up.
Well, and I think the nice thing about those 3 practices are that it's not, again, something that is grandiose, and you can do it wherever you are sitting in the doctor's office, and no one's going to be looking at you because, you're trying to do something that's crazy. So what do you recommend for people who have acknowledged that they've had medical trauma, and we get stuck there sometimes not knowing how to move through that? Like, we don't know how to process those emotions and what a healthy way is to move through that. Because I think a lot of times people will say, like, time heals all wounds, or you'll get past it, or you'll get over it. But I don't know that that is necessarily helpful advice for some of us. So how can what tools could we use for that?
I think this is where somatics does come in beautifully, because I'll name it's first of all, that is not necessarily true for people. Time can make it less raw and resonant, but it doesn't necessarily heal, because if there's a certain smell or voice or experience, it may reactivate that for us, right? Unless we address it. So I'll name that part of the processing and metabolizing of these experiences, it is difficult to do alone. So working with someone, and this is where talk therapy, I think, has benefits, but has its limitations. Because when we are kind of in that stress activation mode, we know that like this is our thinking part of our brain, it goes offline. We cannot think clearly. And then we're left with this part of the brain, which is our limbic system, our emotional part of the brain. And we cannot move things through in that way. And we also know from the brain research that a lot of these emotions are stored in the body. So part of working through it is working with a somatic psychotherapist, someone like myself trained in somatic trauma therapy modalities, because it's hard to do these things alone. It's hard to do these things alone because we do need to sometimes move things out to learn how to deal with our anger in a healthy way. Anger is not a bad emotion. It is not it's a natural emotion, but learning how to healthfully work with it so that you're not using it against yourself is really important.
Now you keep saying somatic. Can you explain what somatic is, just because I think that'll help tie a lot of it together too?
Yeah. So soma is our body. Somatic is the Greek for the living body within. So when we talk about therapeutic modalities, a lot of people are familiar with the top down. This is our thoughts, beliefs, and emotions. And this is where talk therapy, cognitive behavioral therapy, even emotional freedom technique, we're using tapping, but we're using words and affirmations. Somatics is a bottom up, right? We know that a lot of our memories are stored in the body. The vagus nerve, which is that major nerve that wanders from our brain to our lungs, to our gut, to our heart. The information, we know that only 20% of information goes from our brain to our body. 80% of the information about our experiences and our sensations go from our body to our brain. So addressing experiences through the body is really important. And so somatics includes things like breath work, mindful movement, visualization, learning basically what is happening inside, which can be a very scary place when you think that, you're dealing with chronic inflammation, you don't want to go inside. So we do it at a very slow pace because we can only go as fast as your nervous system will allow. But somatics is learning the language of your body so that your mind and body can communicate effortlessly and be like at one with each other, right? Instead of trying to work against each other, which is a lot of time what's happening.
So how does that work for people? Like you had mentioned in the beginning that a lot of us have not a very symbiotic relationship with our body. We feel like our bodies have betrayed us in, the coming out with all of with our HS, and it happens right at the most inopportune moments and all of those things. So how do you start to come to terms and reach a level of like acceptance when we have years of these feelings of pent up frustration and anger, and feelings of betrayal?
Yeah, it's a great question. And it's not necessarily easy. It seems simple, but it's not easy. And everyone's going to have their own journey and their own process. But this idea of can we befriend our body, knowing that our body is always working, our nervous system is always working in service of our survival, right? So can we perhaps even acknowledge like my body, I'm doing the best that I can, right? My body is breaking out or experiencing pain. Is it possible that it need something, right? Does it need rest? Does it need care? I would imagine with most skin diseases, when people are surveyed, when do they notice that they're breaking out the most, or when their disease is flaring the most? There's some stress somewhere in their life, right? So what I would offer is, when our skin, it's sending us messages, our body is sending us messages, can we pause and slow down and just see if we can listen, or just get really curious? What is it that you might need in this moment to take care of you? Again, many of us did not have caregivers that were attuned to our needs when we were younger. We didn't feel seen, we didn't feel heard, we didn't feel felt. We get to have that opportunity to offer that to ourselves. So from a place of, you don't have to go from like, I hate my body, to I love my body, but perhaps can you go from, I hate my body, to I have a body, my body is performing a function. How can I support my body to function more optimally? And that's what we're hoping for. And that's where really focusing on learning how the nervous system works, learning what our responses are triggered, how we respond to stress, so that we can work with that and learn tools and techniques to maybe shift that to be more supportive. Because again, this nice network, if your nervous system is dysregulated, it's going to trigger your immune system to go out of balance, which is going to affect how your skin functions, which is going to affect how all of your hormones are regulated and function in balance. And we know in HS, there's many individuals who struggle with metabolic dysfunction, right? There's maybe blood sugar dysregulation and PCOS, like other hormone, like we can trace it back to the hormones not functioning optimally. And it all begins with the lead driver, which is our nervous system that's kind of in charge, right? Cortisol is calling all the shots. So, because our body, again, it's getting the stress response, all it is getting prepared to take action because it thinks there's a threat it needs to deal with. So it's mobilizing resources, it's mobilizing energy, which is why blood sugar goes up, why insulin levels get dysregulated, because your body thinks, oh, I need energy, I need resources. Blood sugar, this is like, that's the fuel. When you don't really need it because you're not running away from a saber-toothed tiger, that glucose and energy, like it gets stored in our fat cells.
Yeah, it's fascinating. I think there's so many untapped things here. And we had a question or a comment from Lisa. And she mentioned that she just went to a new gynecologist and she had been feeling anxious for days before going. And she had taken medication before the doctor arrived. And she also has past physical trauma and doesn't like being touched. So what kind of, and then out of that whole experience, still got no new advice or anything that she could use for treatment for her condition. And so what do you do with that? Because there's a lot of things there to unpack, right? There's the physical piece of it, doesn't like being touched, which we know when you're going in for HS is something that's going to happen. That's part of their physical exam so they can see what's going on. So how do you kind of prepare yourself for those kinds of things, especially going into it knowing that you have kind of adverse feelings to that?
Totally. I think number one, know that it's okay to not be okay. And sometimes even letting your new gynecologist know, hey, listen, like I've had a lot of experiences with doctors that haven't been positive. I'm not always comfortable with physical touch. And decide ahead of time, what is it that you need from your doctor in order to feel a sense of safeness in the exam room? And be upfront about that, right? You have this is a bi-directional relationship, and it's okay to voice and let someone know. No one, we won't know what the challenge is unless, right, let it be known. And again, before the exam, before you go to the doctor, create your list of resources. What are the things that help you feel more calm, more relaxed? Is it that you need to watch a funny video while you're waiting for the doctor? Like, do you know, like put something on your phone or music, some healing frequencies or your favorite song? Do you need to go for a walk or do some like, even if the HS is really flaring and you can't physically move, there are certain things that there are parts of your body that you can move. Maybe it's just shaking your hands. Again, that's scanning and orienting. But prepare yourself ahead of time. Give yourself enough time to maybe do a few things that help you feel at ease and also bring something with you. I always find, again, when I'm nervous, when I'm feeling uncomfortable, my go-to, moving our body, is medicine. A gentle rocking. You will always see you will always see me doing this. I am soothing myself. And this goes back to our infancy. What did our caregivers do for us? They rocked us. They soothed us. Humming can be helpful. Self-generated sound, um, actually there's science behind it. It generates nitric oxide, which increases blood flow. So maybe you want to hum before you have sex. So, because nitric oxide is really good for boosting that libido. Um, it also increases oxytocin, that love hormone. Again, I think everyone should hum while they're getting bit.
Apparently.
And it also decreases cortisol. So again, these are things that, humming while your doctor is talking may be a little bit challenging, but maybe while you're sitting in the exam room, a gentle rocking, you're using your voice, you're attuning to your breath. So preparing yourself ahead of time, having a few practices that you can do while you're in the exam room, vocalize to the physician like, this is me, and I just need you to know, right? So basically, get your shit together, doctor, because I need you to step it up. And those are just a few suggestions kind of on the fly.
Yeah, and I like what you mentioned because this is a bi-directional relationship. So we have the autonomy to ask for what it is that we need from our physicians and what would help make us feel more comfortable. And so being able to use that voice, I think, will also help so much in that process of feeling like you have something to offer and are asking specifically for what it is that you need. And then it looks like Carol had said on here too that I get this, Carol. I feel like HS has given me imposter syndrome. I find myself paranoid with any doctor and ashamed of how I look. What do I do to overcome this? I think this is so normal for HS patients, especially. I don't know about anybody else, but you find yourself like apologizing to the doctor before you disrobe or before they take a look to, I'm sorry for what you're going to see. Oh, I'm sorry if I have an abscess that's been draining, it might be smelly or whatever. And it's almost like we're telling them in advance so that they're not going to come back to us and say, oh my gosh, what do you have going on down here? Or why does it smell so bad? It's like if we can address it with them, then we take the wind out of the sails for them having anything to say negatively to us. And it is a very uncomfortable situation. And I'm sure you've done this as a derm and, now on this side of it. So what would you recommend for that?
Yeah, I mean, I just want to honor that, Carol. Again, as Brinley echoed, like you are definitely not the only one. And I think, you know, that's a process, right? I think noticing and naming how you're feeling is first and foremost, and just normalizing that. And anyone, dermatologists, we are so used to seeing all scope of things. So I'd be surprised if it would be unfortunate if a dermatologist like, what's going on? My response would be, like, wow, this must be really hard for you. This is really flaring. How are you doing? Right. But I think even if it feels, I guess I just from a place from empowerment, if naming and letting your doctor know, hey, I'm flaring. This is what's going on. And that's why I'm here. How are you going to help me? kind of.
Yeah.
So I think vocalizing it is important too, not from a place that you need to apologize, but more of like, this is what's happening. This is why I'm here. I'm here for support and for help. Right? Again, from a place of inspired action and empowerment. This is neutralize it. It is a fact. You have an abscess that is draining. And I think if we can de-identify, you have HS. HS is not all of who you are. You are not inherently flawed because you have it. It can impact how you feel, yes, and own that and normalize that too. But I think a lot of it is just the de-identification. There is nothing like if you could go in there and just say from a almost like it's the word I'm looking for. You're not trying to disassociate like from but like a third party, like this is what's happening. Very matter of fact. This is what's happening. And just see how that might be different. Just changing the narrative just a little bit.
Yeah, and I found that same thing too, like when going to the gynecologist, if it's a new gynecologist, I've said, oh, I have hidradenitis suppurativa. Do you know anything about that? And most of the time they will, answer to the affirmative and say, oh yeah, I've diagnosed, plenty of people with it. And it's like just putting it out there into the world takes a little bit of that fear and anxiety away. It also gives you an opportunity to educate someone if they say no, they're not familiar with it, which there is a real sense of empowerment that comes with educating other people, especially providers, about a condition and what impacts it has on us as patients. And I would say the same thing, in the same vein about finding your voice. And if you're in an appointment and you're told, like we see frequently when physicians are not really well versed about HS, the first thing that we're told is to lose weight and quit smoking. And we often leave with a sense of shame, even greater than we came into the appointment with. And this is something I want to touch on because I think it's so important. We did not cause our HS. There may be triggers that are creating flares, but your HS is not your fault. And when you go to a medical practitioner, their job is to provide you with medical management for your disease, not to pass blame or give you information like, to quit smoking or to lose weight. Yes, we know those things are great for general and overall health, but the question should come back to what can we do medical management wise for my HS? And I really want to encourage people to be upfront in asking that question, because it takes a lot of courage for us to go to the doctor and to bear those parts of ourselves that we've kept hidden for so long. And so I really want to encourage people to not accept those as answers and to push further for more information and ask the question. So what are we going to do about medical management? And really advocate for yourself in that. Don't just take that answer and walk away and feel bad about the appointment, because that's not the answer. So do you have anything to add to that now that I'm on my soapbox?
No, I think I second that. Listen, doctors are humans, and some humans are assholes. And don't, and I'm not saying like, but really looking at the whole person. And yes, does it make sense to look at lifestyle factors? What are, like, when we talk about stress, it's the exposome, it's everything in our environment that can stress our system and create obstacles to it functioning optimally. Smoking is one of them. Eating processed foods that our body doesn't know what to do with is one of them. But is that the core issue? No. Most of the time, we are smoking, we are overeating, we are scrolling Netflix, we are overworking because we are just trying to feel better. We are just trying to find ways to cope with the overwhelming frustration, anxiety, and pain that whatever situation that we have been dealt is creating inside of us, right? So in many ways, thank you, smoking and drink for trying to be a resource for us to manage the uncomfortable emotion. Recognizing that those resources aren't supporting us and can contribute to further inflammation, right? I think that's recognizing where decreasing smoking, or ideally stopping smoking, and changing diet and prioritizing sleep can come in handy. So I will just say it from that perspective. But those habits that they're trying to dissuade were actually your body's and way of trying to cope. So in many ways, yeah, put the shame aside and be like, ooh, thank you, body, for reaching for the, but it's catching yourself in the act and having that awareness of that's your default mode. So then you can find a different resource for yourself, a different way of coping for yourself that actually serves your higher good and your health.
Yeah.
Yeah.
And I see a comment in there that, wow, the doctor told me I needed to lose weight and stop smoking. I did it and it didn't change the HS. This is very, very common. In fact, sometimes dramatic weight loss can actually make your HS worse, which is not something that they typically will tell you. We've seen so many people undergo like gastric bypass or sleeve surgery or something along those lines. And because you now have more hanging skin and you've created like the perfect microbiome for your HS to flare. So it's not uncommon. Hi, baby.
Your dog was barking. My dog walked in on the action. Here we go.
Yeah, so we know that that's not something that's uncommon in HS. So definitely.
And it's interesting too, because extreme diets, that's also over exercising. These are stressors on our body. It's going to drive up that cortisol. It's going to further dysregulate your nervous system. And again, depending on what we're eating, that microbiome, may be affected. We need fat, fiber, protein. We need a balance. We may, in some of these surgeries and procedures, may wind up with nutrient deficiencies that our body needs to optimally function and support ourselves. So, I think in many instances, there are basic premises for optimal health, right? We want to eat well, move well, sleep well, but it's usually never one thing. But the core that's driving all of it, like stress in all its forms. So if we can learn how to better manage the stressors in our life, it's going to create opportunities and avenues for all the systems in our body to work more optimally.
Perfect. Yes. And then let's address this one from Zed. So he's a physician. I'm sorry, they're a physician. I'm not sure he or she. Have a young HS patient who has been clearly traumatized for so long that she has a baseline distrust and defense that is really hard to break. Had a hard time even working with her to get the diagnosis of HS, took long visits and biopsies because the clinical diagnosis wasn't convincing enough. I'm in an underserved area where I'm the only derm provider. I want to help her, but I get frustrated sometimes with how defensive she is. What is your advice for me?
Yeah.
I'm going to start with from the patient perspective really quick here. I personally think we are armed automatically with a sense of distrust based on prior experiences and just information that runs rampant. I also think that there is a level of where physicians don't necessarily understand, or patients don't feel that physicians understand the level of pain and the impact on our daily lives and activities of daily living with this disease. So in my opinion, I would level with her on that. Like, I can only imagine how hard it is for you to live with this every day, to really empathize with her from a genuine place, which you're on here, which means you're coming from a genuine place because you wouldn't be taking the time to be here and ask these questions if you weren't. So thank you, first of all. But I would ask her that, how are you? How is this impacting you? How is your mental health? How can I help you? Because that is what's going to change her opinion about the medical field. And as an HS patient, I've attuned it to this. We are not your sprint patients. We're not your, SCC or your melanoma patients where you're coming in, having Mohs surgery, and you're out the door, and we may see you again in a year for a skin cancer check. We are your marathon patients. You have to run along with us. We have to feel like you are our partner in our care, or it doesn't work as well as you would think. So that would be my advice, is to really ask her, how are you? How is this impacting you? And how can I help you with that? And I think you may see her crack a little bit.
Yeah, I was going to say the exact same thing. I think it's, we were taught in medical school that the skill set that we needed was how to do procedures, clinical pathic correlation, how to put together a skincare regimen, and blah 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 blah. That is not the most important skill set that we need. The most important skill that we need to cultivate is our presence and our intention of presence. Can I be there in the moment with the person sitting in front of me and have them feel felt? Exactly what you just said, Brinley, of like, what is the hardest part of living with this condition? What is it that I can do? What is it that would be most helpful or most supportive? And sometimes maybe the patient walks out of there with no medications at all, but just that they felt seen, that you have a plan, that you're going to come back, that we're going to do the biopsy, that I'm going to see you back, I'm going to check in with you, I'm going to offer you some resources. Maybe there's a podcast or a book or like a practitioner that you can go to, right? But I teach physicians this too. In fact, at the American Academy of Dermatology in August, I'm going to teach this again, the embodied physician, that our greatest prescription that we can offer someone is listening and being present and noticing what's happening inside of us as we are watching what is happening before us with the patient. Because if they're getting very activated and anxious, then we have to respond with, maybe we slow down our tone of voice. Maybe we ask them if they need to pause. Do you want to breathe together, right? Sometimes, like, it's just checking in, like, hey, I'm noticing that this seems really hard for you. What's happening? And again, that puts the ball back into your court of saying, being able to vocalize a name. This is not working for me, doctor. Like, I'm feeling very uncomfortable, right? So as the providers, we need to be attuning to our soma, to our body, to our presence, so that we can make darn sure that we can be attuning to the person in front of us. Because this is relational. This is what trauma happens in relationship. It can be healed in relationship, right?
Yes.
So oftentimes, if someone is coming into a situation where they don't feel like they can use their voice, they have had a lot of shame, they don't feel seen and feel heard, we have an opportunity to create a different paradigm, to create a different type of relationship.
Yes, and you're always welcome to give her my email address too. I'm happy to help talk with them, because I think sometimes that can be also like knowing that they're supported by a community as well, and that most of us have had similar experiences. But then once you do find a good derm who's really, like, you sound like you're in there, you're in there and you want to win it with her. So I'd be happy to do that as well. And then it looks like we have another comment about, it's been such a financial and mental strain on my life. Have you seen this go away? Can the skin clear? Do you think they'll find a medicine? First of all, it's a really good time to have HS. Never is a good time to have HS, but right now it's a really good time to have HS. We have now 2 FDA approved medications. There's a third that should be coming at the end of this year or beginning of next. There are a ton of clinical trials happening for new medications that are working for HS. You can go backwards in your staging. You can go into remission. Those things are possible, but the future is so bright right now for HS. You guys just hang in there. We went for so many years with having no FDA approved treatments, then one, and now we're going to be getting more in a really short period of time. So it is possible. And I don't think we may not be anywhere near a cure, but the management of our symptoms will be, coming forward much more rapidly than they have before. So it's a very exciting time for HS.
Yeah, and I would say it's a both and. I think it's exciting that there are these medications, but a lot of them, they are suppressing symptoms. And the root cause of so many of these things is, right, like what is turning on the inflammatory response? It's the nervous system dysregulation. So we need to be working from both angles, so that maybe you need less medication less often, and really getting at it at its core. There is a genetic component. There are so many factors. This is not just like calm your nervous system and you'll be fine. It is multifactorial. And as Brinley said, this is a very exciting time. But again, we don't just want to put Band-Aid and suppress the symptoms, because if you go off the medication, will you flare again? It's maybe we do need to suppress the symptoms so that you have some time and some runway to be able to support yourself once you can move again and feel again, and like, right, so that we can kind of turn down the dial on the fire that's like, or the gas that's throwing onto the flames of all the inflammation. So
Yes, I think that is so true, because it's like you're in fight or flight and you're constantly dealing with what is screaming the loudest, which happens to be your HS. So you don't feel like there's a point that you can sit back and like really try to work through or figure out or process anything, because you're just always trudging through that. So I think, symptom management is very helpful in being able to give you the space to be able to work through some of that. And Jennifer asked, is there anything I can do to help my partner support me emotionally? Sometimes I feel like I can't explain what I'm going through, or he's really confused and not sure how to be there for me. Oh, girl, you're not alone in this. I think as a patient, it's very, very hard to explain this condition and the ways that it impacts us in every facet of our life. I think that the best thing you can do is to be honest with him about that sometimes you have trouble explaining it. I think it can come across as frustration sometimes, because they can't understand the pain that we go through. And so they try to akin it to something that they know or have experienced themselves, but it feels like it's diminishing the pain that we actually deal with. So I think that can be really hard in a relationship. And it's also hard to ask for help. It's hard to put yourself out there, to be vulnerable. I know I have issues with telling my husband or kids when I'm in pain. And I think I do a really good job of hiding it, but really I don't. It's written all over my face and they're like, Mom, we know you're struggling. But it's hard sometimes to admit that, because I don't know about anybody else. I don't always want to be Debbie Downer who's having a hard time, And so how do you have room for all of that to exist?
mm-hmm. Again, amazing advice, and from your lived experience, it's so vital to share this, and that's why I love being part of this space right now, because I think you feel not alone. You're not the only one. I think the biggest question for Jennifer too is there anything I can do to help my partner support me emotionally? I think from a place of curiosity and compassion, to ask yourself that first. What is it that you really need? What is it that you really want? And I think many of us, myself included, this is one of my core wounds. I quieted that voice of what I needed because I was told that my needs weren't important at a very young age. And I've had to work really hard, right? I think that's where you start. People just, our partners, they love us, right? They just want to help, but they don't know how. We have to tell them how to help us, which can be hard, but we have to start with, what is it that I really need in this moment, right? What is it that I really need? And I think in a relational dynamic, creating a little separation of not like you do this or when you do, it's like, when this happens, I feel X. When you do this certain thing, it makes me feel, right? It takes a little bit of the sting out of it, because it's not that you're a bad person or you don't love me, you don't support me. It's this particular action, this particular behavior is affecting me in some way, or what I'm experiencing right now is affecting me in some way, and I need X, right? But I think the first step is, your partner won't know how to support you emotionally if you haven't asked yourself from a place of loving kindness and compassion what it is that you really do need, because you deserve to have your needs met.
And especially as a mom, it's really, really hard to feel like you can't be what you want to be and feel like your kids deserve for you to be. And I always say that when you're a mom with HS, it just looks different than it does for other moms. And it's not good or bad because our kids are learning a different lesson than other people's children are learning. Ours are learning empathy and how to potentially be more helpful, and be in tune with what needs are outside of themselves. So I think they're learning different lessons than other people's children are, and it just looks different. And I hate so much when parents especially are hard on themselves about their parenting with HS. Because it's such a personal thing, and it breaks my heart when moms say that they can't be the mom that they want to be. And what you don't know is that you're probably doing your kid a huge service by being who you are for them, just the way that you are, showing them that they don't always have to be the strong one who can't say, I need today to just get my shit together, or I'm really struggling today. Can I get some extra help? And watch people, band around them and help them with whatever that is that they need.
Yeah, I second that. I second that. I think it's also, looking at from a positive side of boundaries, right? Our skin is our ultimate boundary. Um, and we can reinforce that. We can use that for a metaphor for our life, right? As well. What happens when our boundaries are leaky? We can feel very angry or resentful, but using your voice, like you said, like, I can't do this and I need your help. That's a healthy, that's teaching our kids, like, that's a healthy boundary, right? Asking for help is not a weakness. Asking for help is not a weakness. It's actually probably one of the strongest, most courageous things that you could possibly do. We were not, right? It's Deb Dana, she's a psychologist, and she says, we are wired for connection, we long for connection. When you look at the scientific data, this is mostly from the cancer literature, but I know that it spans for all chronic illnesses. Social isolation and lack of social support is the greatest predictor of disease severity and outcomes. We need each other. We need support. You are not meant to do this alone. So it is not a sign of weakness. It is actually in service of your survival to learn, get to know yourself, what you need most, and not be afraid or ashamed to ask for it. Most of us
Yeah.
want help. Most of us want to help. We just don't know how. We don't know how to be of best service. So we need you to tell us exactly.
Yes. Exactly. And one of the things my husband always said is, why would you, because I'm like, well, I don't want to tell you when I'm in pain. And he's like, well, why not? Like, if I got sick and was throwing up, you would want me to tell you, right? Yeah. He's like, so why would it be any different with your HS? And I was like, well, that's a really good question. And I don't have the answer to that because it becomes such a personal thing that we feel like we have to go alone. And I think it was Jennifer who had asked that question about how do you get your help or your spouse to help you and feel emotionally connected with them about that. And I think we need to figure out, like you said, what is it that we need first? And sometimes we don't always know. And that's an okay answer too. Just to say, I need help, but I don't know exactly what that looks like right now. So that they are aware that you're thinking about it as well.
I thought my dog was going to unplug the computer. I was like, oh.
It looks like, okay, so Monique mentioned that I'm a parent of a daughter with HS. She exhibits behavior that is hard for me to relate, like not cleaning her room, doing her laundry, laziness, or that's how it appears to me. I'm taking these sessions to learn how to be more empathetic. How can I know if I'm enabling or helping? Okay, sister, I have two kids, both with HS. I have a 16-year-old, well, she's 17 now, with stage 2 HS. She's my biological daughter. And then I also have a 21-year-old stepdaughter who has HS, and she's also a stage 2. This is how it comes across sometimes, for sure, because I think what parents don't know is that there is a lot of fatigue that can come with HS. So it looks like it's laziness, and I can completely see that from the outside, but it may be that there's pain happening as well that she's not sharing with you. So I would ask her those questions. Is there something that I can help you with? Maybe approach it in can we do this together? Like, is there something that's hurting you? How can I help you? My daughter, she does all of her own laundry and everything, but still sometimes she's like, Mom, I'm flaring. Can you help me with my laundry? Absolutely. So some of it is the way that you approach the question. Coming up with another term sometimes is helpful. Like when she was younger, we would call them owies because it comes with a sense of empathy already. And I think that's helpful. But now as she's getting older, she'll say like, I'm flaring. And that's the key word for it. So maybe because it can be hard to talk about sometimes in really technical terms. So maybe ask those questions, or how can I help you? Is there something that I can do to help you? I think if they feel like you're partnering with them, it goes a long way for sure.
Yeah, I would agree. I think, again, I keep harping on like nervous system dysregulation. Our body responds in one of essentially 5 ways: fight, flight, freeze, fawn, which is, the people pleasing part of us, or we shut down and collapse. And, when we are in pain or, in worry, and it can tax our energy and keep and it can dictate how we respond and how we behave. So just as Brinley said, understanding sometimes this is a physiologic response. The procrastination, what appears as laziness, could be someone in a functional freeze. They literally cannot move forward because their nervous system is in lockdown, because it is too much for their system to handle. And this can happen especially with chronic pain and what have you. So from a place of curiosity, and listen, as a parent, I lose my stuff, I'm like, come on already. But if I take a step back, I'm like, all right, from a place of curiosity and compassion, instead of accusing, asking. I'm noticing, you didn't clean your room. What's going on? Like, how are you doing? Like, is there and I'm not going to reiterate, what Brinley said. It was so wise. But I think, again, curiosity and compassion will always get you further than on the attack mode, because a lot of times it's because the nervous system is perceiving a threat. It could be the physical threat of the pain. It could be the emotional and mental threat of feeling anxious, feeling overwhelmed, feeling isolated, feeling angry. And it's going to inhibit our capacity to be able to do our daily activities and participate in things in the way that we normally would want to.
Yes, absolutely. And we're out of time, but we are going to address this one question that we have two questions about, like, how do we explain to a potential spouse about HS if it's in the groin area? And can intimacy trauma, is intimacy trauma prevalent with HS patients? And is there any way to work through this on your own? This is heavy, heavy shit. And from an HS patient perspective, it's making me upset. This is one of the areas that is really undervalued when it comes to relationships or doctor-patient relationships. It's very, very rare that a dermatologist will ask you about your intimate relationships. And it's such an important thing. And it does have a huge impact on us. And it doesn't matter how many times our spouse may tell us that they do not care about the scarring or about the active abscesses. It doesn't matter. That's never a good enough answer. They couldn't give you a good enough answer in most cases. One doesn't exist because it's such a personal thing. And I feel personally like, yes, you can work through some of that and become more comfortable with yourself with a partner who's really good and caring about you. But I know most of us have had experiences that were not positive, and that has really led to the way that we feel about ourselves now and to future relationships. I do think for me, the best option was always to be honest about my HS before getting into a relationship, because I felt like it was a way for me to stop them before it became an attack of people thinking the wrong thing and that I had potentially an STD or something like that. So I felt like it was the best way for me as a patient to address it was to bring it up first, give people an opportunity to look into it further on their own, and then come back and ask questions if they had them. And then as far as working through that, I think that therapy helps with that. I think talking to your spouse about your insecurities and asking them not to say, well, I don't think about it that way. Just really hearing you and listening to what your feelings are about that it was a really helpful exercise for me.
Yeah, I love that. And from my perspective, this is where the somatic work really is so valuable because it's learning how to be in relationship with your body. Um, Dr. Lori Brotto actually wrote a book, Better Sex Through Mindfulness. And again, the body, especially if it's flaring and there are abscesses and scarring, it can feel like a very unsafe place to be. But we can learn how to create a felt sense of safety inside of ourselves once we get to know how our body responds. And a lot of it does have to do with doing our own work first. What does touch feel? How do I know where I would like to be touched? What does touch feel like? How do I know? How can I befriend my body? It'll make it that much easier to be able to communicate with somebody else your needs and your comfort once we do this inner work for ourselves. And that's the work I love doing with people because there is nothing sexier, right, than feeling at home inside of yourself, which it's simple, but it's not always easy. And it is hard to do on your own sometimes. So if you're having a hard time, don't beat yourself up. This is not easy stuff, especially if you've already had experiences that, created discomfort and pain.
Yes. And the one thing I would say is you guys are so not alone in any of your feelings that you have about your HS. Chances are there are thousands or hundreds of thousands of people who feel the exact same way you do. We've just been isolated for so long until recently when this, talking about HS has become, we're trying to normalize this. And so all of these conversations that we're having are helping us get to that place. And I just want to say how much I appreciate everybody for showing up today, for asking your questions, for being vulnerable, for putting yourselves out there, for attending this. There are a ton of resources available to HS patients. There are a bunch of Facebook groups. Some of them are like the Wild West. And once you get in them, you'll realize that and you'll want to get the hell out. But there are some really good Facebook groups that are information based. There's Hope for HS, which is also another patient advocacy organization that they focus on support groups. So maybe check them out. You can find the resources on HS Connect's website as well. We list a bunch of different resources and we have mental health and all kinds of resources on our webpage as well at hsconnect.org. So if you're looking for some of those groups to join that you can be around other people who have the same questions and struggles and all of that, those places absolutely do exist. And you are anything but alone in this whole journey. So Dr. Barr, thank you so much for joining us today. Thank you for all of your insight. Thank you for everything you had to give and share with us. And then we're also going to put out some resources that will be below. Dr. Barr also does a free consultation that if you're interested in that. So we'll list all of that information. It'll probably show up in the replay piece of it. So be on the lookout for that. And again, thank you guys. Thank you to the HS Foundation for hosting this. Thank you for sticking in here longer with us so that we could get through most of the questions. And we will see you next time. Don't forget, there's another Spotlight HS next week too. Thanks, guys.